Hi, I'm Dr. Charlie Liu, and today I'm going to be talking to you a little bit about the signs of prostate cancer, when you should go and see your GP, and also when you should ask for a PSA blood test. So prostate cancer is getting a bit more attention these days. You might have seen people talking about it in the news, and this is a good thing. Prostate cancer is obviously the most common cancer that men get. It affects about 1 in 8 of us throughout our lifetimes, and that may be higher for certain ethnicities. So if you're Afro-Caribbean, this may be as high as 1 in 4 men who get it. So it is important that we know what symptoms to watch out for, and we know when to go and see our GPs so that we can get tested and try and catch this early. But along with this increased awareness is a bit of information about the PSA test. So we do quite commonly get men coming into the surgery and asking whether they can just have one, even though they don't have any symptoms. And although this is fine, we should be aware of exactly what the PSA test is, how accurate it is, and the kind of evidence that we have for use as a screening tool. So let's start off by talking about exactly what the prostate is. So you have your bladder, which sits in your abdomen, that stores urine that comes from your kidneys, and the prostate sits at the neck of the bladder. So I've drawn a very simple diagram here just to try and illustrate exactly what's happening. You see the kidneys here, the bladder's here, that fills up with urine, and the prostate is this little lump at the bottom of the bladder. So it's kind of donut-shaped. It sits around the neck of the bladder. And in younger men, the hole in the middle of this donut is perfectly sufficient to allow urine through. But as you get a bit older, the prostate invariably begins to increase in size. And as it does that, it begins to squeeze the neck of the bladder. And as you can imagine, that makes it much harder for the urine to flow out. So this enlargement of the bladder happens in almost every single man that gets older, unfortunately. And the majority of this is benign enlargement. So it's a condition called benign prostatic hyperplasia. It's a long medical term that basically means benign enlargement of the prostate, and that is a separate thing to prostate cancer. Now, slightly confusingly, depending on who you listen to, you might hear it referred to as a sort of benign prostate cancer, and it's probably best to just try not to conflate those two terms. You have prostate cancer, which is relatively rare as a condition but common as a cancer, and you have BPH, which is almost universal in elderly men. So the symptoms of prostate enlargement are all related to its effect on the bladder. So the cliche is obviously the elderly gentleman who needs to get up a lot at night time. Most of us will probably get up either 1 or 2 times a night, but if you're getting up more frequently than that, and particularly if it's getting worse as the months go on, as the years go on, that's a sign that your prostate may be enlarging, and it may be a sign to go and see a GP. The other symptoms that can happen during the day are that when you go to the toilet, you find that the urine is coming out a bit more slowly than it used to. So again, this is because the prostate is squeezing on the neck of the bladder. You might find that instead of just being able to go in one stream, it's sort of stopping and then starting and then stopping and starting. And you may even get to the end of going to the toilet and find that you don't really feel like you've emptied your bladder completely. And all of these are signs that your prostate might be enlarged. Now, there are other bladder conditions, so it's not an absolute foregone conclusion, but these are quite likely to be prostate related, so go speak to your GP. Now, in this group of men who have symptoms, then the PSA test, the PSA blood test, which you might have heard about, is quite a useful test, and we do recommend that most people who have symptoms have this test. And this is also true if you've got a strong family history. So, for example, if you've got a father or a brother who has had prostate cancer, then again, this is we would generally recommend the prostate test, the PSA. But as a screening test, things start to get a bit more complicated. So in the UK, we have a few different screening tests. We have the bowel cancer screening test, the breast cancer screening test, the cervical cancer screening test, and all of these are pretty good screening tests that we recommend for everyone in the population who's eligible, and they do save lives. With the PSA test, it's not recommended in the UK. It is in certain countries. So I think in the US they use it quite commonly as a screening test, but the evidence is a lot more equivocal. And I'll try to explain a little bit about why this is. So to start off with, the PSA test is not a particularly accurate test. It has a false positive rate of nearly 2/3 and a false negative rate of about 15%. False positive means that it comes back as high, raised, but you actually don't have prostate cancer. And a false negative means that it's come back as normal and you feel relieved, but you actually do have prostate cancer. And you can imagine with a rate like 2/3, that's a pretty high percentage. So it's not a very accurate test. And the other problem that we have is that even the cancers that it does pick up correctly, when it does diagnose a prostate cancer, sometimes those prostate cancers would never have killed anyone in the first place. Quite a lot of prostate cancer is very slow growing. And so it might be that if you are, for example, 80 years old, that the prostate cancer was just going to sit there, you'd have never discovered that you have prostate cancer, and you might have died from dementia or a heart attack or something like that, and you would have gone to the grave having never known that you had prostate cancer. But the PSA test might be able to pick that up. So the statistics are that if you screen 1,000 men with a PSA test, about 140 of them will have a raised PSA. But most of those people don't have a prostate cancer. So if all of those 140, or most of the 140, go on to the urologist and they end up getting a biopsy of their prostate, about 20 of them in total will actually have a prostate cancer diagnosed. So only 20 in 140 who have the positive PSA test. And that's 20 prostate cancers in 1,000 men who have the PSA test. And out of those 20 prostate cancer cases, actually only 3 of them will be advanced prostate cancer. Most of them will just be quite low-level prostate cancer that probably wouldn't really have done much. And out of those 3 advanced prostate cancers that you find, you can probably save 1 life from using the PSA test to diagnose it relatively early. So out of 1,000 men that you test with the PSA test, you might save 1 life. And the problem with this is that when we do the PSA test and we do the biopsy does also come with some side effects. So if you are to biopsy 140 men who have the positive PSA test, about 20 of them will develop a fever from the procedure. Most of them will get some blood in their urine, some blood in their sperm, which can be a bit unpleasant. But the worrying one is that about 1% of people who have a biopsy will end up getting sepsis, which is quite a serious condition. It's an infection, essentially. And so when we look at the mortality overall for those 1,000 men, yes, you might save the single life from prostate cancer, but you probably lose that from the risk of sepsis. So overall, it's very, very neutral. So, like I said at the earlier part of the video, if you have symptoms, or if you have a strong family history, the evidence that the PSA test is useful is weighted slightly better for you. And you should go to your GP and at least have the examination, which is the unfortunate finger up the bottom, which is a bit unpleasant, but that will help us to discover whether there's any signs of prostate cancer. And you should also have the PSA test. If you're a person who has no symptoms, it's not that we recommend against having the PSA test, but you should be aware that the evidence isn't there. And so we, as medical people, don't recommend it as such, but we're quite happy to discuss it if you have strong feelings about it. So do come and talk to us if you have decided either way. And if you have symptoms, then come to the GP as soon as possible. Even if you have the benign form of it, it is something that's treatable, so there's no need to suffer in silence. You can come, get some medication, and stop waking up 5 times a night, get a good night's rest. So I hope that's all been useful for you, and that you have some of the knowledge and the facts to make your own decision about when to ask for the blood test, and also a bit of an idea of some of the symptoms to watch out for if your prostate does seem enlarged, getting up in the night time, slow flow, stopping and starting, and not feeling like you've really emptied your bladder. Any of those, do go see your GP. Alright, well, I hope that's been really helpful, and thank you very much for watching the video. If there's anything I haven't covered or any questions that you have, then please do leave it in the comments below, and I will try and answer it as best I can. Have a very nice day.